95.9 CV Radio, smooth and relaxing favorites. The Morning View with Jay Zieger at 8:32. We are here with Dr. Javier Canasi from the Canasi Medical Institute talking about losing weight because my special guest host for the week, Emily Pantelides, a new mommy.
Airing all my dirty laundry here.
5 months ago, you had a little baby boy named George.
And he's perfect and wonderful, except no matter what I do, I cannot get off these extra 15 pounds. I mean, it's 15 pounds. I gained, at this point, I've said it a million times, but I gained about 55 pounds when I had him.
Wow.
And
I probably shouldn't say wow when a woman talks about gaining weight, right?
No, you probably shouldn't say that. Not the best thing to say.
All right, let's rewind that.
Okay, yeah. But Dr. Canasi, what's interesting about you is I was just telling somebody that I've seen people come out of your office that are really losing weight. I mean, whatever you're doing is working, so I just want you to tell me the secret. Maybe I have to come see you, but I want to know what the secret is. And don't say, eat right, work out.
Oh, that's what I was going to say.
I know, because, I'm doing that. I don't know, I don't want to hear that. I want the magic pill.
The magic pill.
This is coming from a guy who had Little Debbie cakes yesterday, so maybe I shouldn't be giving people advice.
Don't say that in front of Mr. Canasi.
They were so
the weight
yummy.
loss doctor.
All right, we got a couple phone calls here. Let's go to Joanne in Stewart. Joanne, do you have a question for Dr. Canasi?
Postmenopause, correct? No, we were off. We were
offline. We were talking about that.
Talking
you were
about
just
that,
saying that.
and clearly, postmenopause women are the hardest to lose weight. But if there is a metabolism booster, let me know because I'm going to buy it. There's no such thing. Okay, there's no. First of all, you can't gauge metabolism, right? We know that weight loss is a reflection of your ability to activate your metabolism. There are some things that you can do, but they're much harder for postmenopause women. But you can achieve it. You have to eat. You have to eat frequently. You have to eat the right composition of food, and you have to know how to blend the exercise with your health, with your eating plan. So you can lose weight. You will lose those inches around the abdomen, but it's going to take you a little harder. It's going to take you a little longer, but you will achieve it.
So you're saying it can be done?
Oh, absolutely.
Okay, because
100%.
That is the hardest.
Right. Well, it really depends on your medical problem. So I try to design a plan that's according to your medical problem. If you're a diabetic, then a certain dietary plan will be. So if you don't have any issues, right? So a couple of tricks, a couple of rule of thumbs are that you want to make sure that you have at least 3 meals a day and 2 snacks, right? And the meal should be if you look at your hand, right? Most of it you should have at least 4 to 5 ounces of protein, or a nice size salad or fiber, right? And a low amount of carbohydrate. Now, you got to have healthy carbohydrates like sweet potatoes, brown rice, quinoa. So there are things that you can do that will help you be full, give you the energy so that you can exercise. So you will lose the weight. You got to stick with it. It's a lifetime commitment, but you will achieve it. You're welcome. Good luck.
All right, great. Thanks for the call, Joanne. All right, let's go to Renee. Renee in Jupiter. Renee, do you have a question for Dr. Canasi?
Well, you're very easy to get you to lose weight. You're already there. You just need to eat less calories. And you say you're eating the right calories. Most patients, when they tell me that and we go through it in detail, you'd be surprised how what they think are the right calories or the right composition, it's not. But you're already there. You're already motivated. You're embracing a lifestyle. you're trying to eat healthy, and you're already incorporating an exercise program. So for you, this should be a piece of cake. This is just a matter of tweaking.
You know, it's funny because you make it sound very easy to lose weight, when in reality, I don't know if whatever you're doing is working at the Canasi Medical Institute, but I mean, it is hard. It's hard to lose weight for people.
So I hate the word diet, because when you hear that word diet, you know, you usually associate it with a fat, right? With some kind of a gimmick, you know, the cauliflower,
or the soup,
the
all you need, the
all you
cabbage
can
soup,
eat.
yeah.
You know, those things, you lose weight, but you're going to gain it back because you're starving yourself. Okay, diet is the wrong term. We want to focus on lifestyle changes. We want to eat healthy, and we want to follow certain principles that are going to be lifelong commitment. And you will, and that, of course, you're going to have days that, you know, on a football day, you're gonna want to have some chicken wings or something,
Dipped
or you're
in
gonna
ranch.
or
Yep.
you have a family gathering. You're gonna have cheese, and you're gonna have some wine. You got to be able to embrace those things. You got to be able to enjoy those things. Otherwise, then it's not going to be fun. So as long as you do things in moderation, but for the most part, if you eat healthy and you exercise and we tweak it, you'll achieve it 100%.
All right, so it sounds like you gave me some good news, Renee. You feel better now? All right, thanks for the phone call. All right, so, Emily, despite you not wanting to hear that you have to eat right and exercise, that's the advice we're giving you today.
But, you know, you are saying that there's a certain amount of foods and certain foods that you can eat. I'd like to, you know, maybe what the snack. Well, okay, give me this. What snack should you eat?
Well, here's what you
Almonds?
shouldn't eat. Okay,
Yeah.
and a lot of people will say, I'm eating healthy, but okay, what are you eating? I'm having 6 fruits a day. And certain fruits are very high in sugar. Bananas are high in sugar, cantaloupes are high in sugar, melons are high in sugar. So if you're eating a lot of fruit and you're having a lot of sugar and you're priming your insulin, you're not really eating healthy. So what you want to do is you want to eat a high fiber diet. Now, most nutritionists will tell you, yeah, eat a high fiber diet, go and eat all the fiber breads. It's not that easy. You got to design a program for you, okay? But you want to maintain a high fiber, common sense, high fiber, low sugar index diet.
How does it work in your office? You come in for a consultation, then
You come in, we take a full vital signs, a medical history for the most part. I try to identify as an internist whether I think there are some medical issues that may be contributing to your weight, or whether you're on medications that may be making your weight loss a little more difficult. Once we establish that, if I think you need certain tests, I'll tell you. Otherwise, then we'll go ahead and incorporate a dietary plan or a lifestyle plan that best suits you. So we'll discuss what you like, what you dislike, what kind of exercise you like to do, what time you like to do it. I try to teach patients the triangle effect to lose weight. You've got to exercise right, you got to eat right. But guess what? You also have to sleep right. Those hormones, cortisol and many of those hormones that need to be shut off, they do shut off when you sleep. So if you don't sleep right, like patients with obstructive sleep apnea, patients with sleep disorder, you'll see them, they do gain weight and their weight loss may be very difficult. So if you eat right, you sleep right, and you exercise, weight loss is easy. If one of those walls are off balance, then the other two have to compensate.
All right, excellent. Dr. Javier Canasi from the Canasi Medical Institute, thank you very much for coming in today. Emily, sorry, it's all about diet, all about exercise.
Maybe I'll make an appointment. Where do I find you again? Are you in what
I'm in Palm Beach Gardens. You can find me on Canasi Medical Institute.
All right, maybe I'll be there. This sounds like that's a trick or something.
There you go.
No trick.
All right, thanks for coming in. We're coming right back. 8:41, The Morning View on 95.9 CV Radio.
Hi, I'm Scott, owner of Oceana.
You know the number
Proud to be
one
the official
reason
coffee of
people
CV Radio. Watch me
don't
roast
lose
the
weight
beans
after
the
a
first
week
Thursday
is
radio
because of the
and take some
alcohol.
home for yourself.
Is why?